Dear learners, welcome back to NPTEL online certification course on novel drug delivery system. I am Dr. Satish Devanapelli, Assistant Professor at Department of Pharmaceutical Sciences and Technology, Institute of Chemical Technology, Mumbai. So, in our on gastro-retentive drug delivery systems, so far we have discussed what are the gastro-retentive drug delivery systems, and then we have discussed what is the need and the advantages and some of the mechanisms we have discussed. And in our previous lectures, we also focused on the various types of the systems, which are types of gastro-retentive drug delivery systems, low density floating gastro-retentive drug delivery system. Then we discussed high density gastro-retentive drug delivery system. Then we have discussed expandable gastro-retentive drug delivery systems, and we further discussed on the superporous hydrogel gastro-retentive drug delivery system. Further we discussed on the mucoadhesive gastro-retentive, and then we have focused on the rat forming magnetic and ion exchange resin based gastro-retentive drug delivery systems. So, today we are going to discuss on the topic, which is the recent advancements of the gastro-retentive drug delivery formulations, and also we are going to see few examples which are available in the market, which are comes in the technology of the gastro-retentive drug delivery systems. So, as we know, in our previous slide also we have discussed, we have almost 8 types of the gastro-retentive drug delivery systems. So, here is the one type of technology which will help to maintain the oral drugs for the long lasting in the stomach. So, the technology name is the Accordion pill. So, here we can see in the pictorial representation. So, these are the multi-layered polymeric films which comes as in a compressed format as in a capsules. So, here you can see the various layers of the polymers, and that is folded and placed in a capsule. So, that is the technology of the Accordion pill, and this people have used in the mechanism that is expandable gastro-retentive drug delivery systems. In that the unfolding type of the mechanism. So, after administration, so your capsule will disintegrate, and then the folded material, that polymeric material will release. So, we can go by this way also. After administration, that will separate out or it will disintegrate, and the material will come out into the contact of the GAT fluid, and then this layer contain laser drilled openings. So, with that your drug molecule will come out and release from these polymers based on the openings. So, that will help in the drug release. So, with this system we can expect the release at least up to 12 hours in the fasted conditions. So, while taking, the size will be very small as in a capsule, but after disintegration it will convert into the expandable form. Once the drug release is completed, and after the release, and that will shrink or that will degrade, and it will come into the into the small in the size, then that will leave from the stomach. So, this is the fate of the expandable unfolded gastroretentive drug delivery systems. Here such drugs can be used for the drugs which are suffers with the narrow absorption window as a challenge for the treatment. For example, levodopa and gelplon. So, such drugs can be converted into the GRDDS by using Accordion pill technology, and this technology developed by the Intech Pharma, and these formulations will help in the Parkinson diseases. If you need more information, so you can visit this site, so that will help to learn various technologies. So, the second technology is Acuform technology. So, this is developed by the Depomed. This used for the site specific drug delivery to the upper gastric tract, and here we use the polymers which are hydrophilic, and we can make hydrophilic matrix formulations in the tablet format that will swells in the gastric fluid and it will form the gel matrix. So, this may you consider as a swellable polymer, swellable mechanism, and that will help for the retention of 8 to 10 hours in the GIT fluid, and with that time it will release the slowly release the drug from the matrix gel. So, with that we can also expect the increased gastro retention time with the Acuform technology, and with that we can release the consistent drug release, and also it will reduce the variability due to gastric motility, and these are the some of the market products. Glumedja and the Gralize will help in the as an oral dosage forms. You can see that marketed products in the picture. So, which are developed for the extended release by using of such technology for the gastro-retentive drug delivery systems. The third technology which speaks on gastro-retentive innovative devices. So, these are the dosage forms which help in the releasing of the drug for the immediate as well as for the sustained release. So, it contains two different types of layer. You can see in the pictorial representation there is a immediate release layer and another one is the sustained release layers, and this is also comes into the category of the two types of the mechanism, that is unfolding and second one is a swelling mechanism. And unfolding we know as we discussed in the previous slide also, and the second one is will help in the swelling, that polymer will swell, and if you can also provide with the floating system, right. So, that will also help into the lift up your dosage form in the stomach fluid. So, yeah, so here this will help for the as in a swelling mechanism. So, with this we can also expands in the stomach and remains for the 8 hours. You can see the size is expanding after taking of gastric fluid, the size is extended. So, that expansion will help for the higher retention, with that we can increase the absorption and reduce the side effects, and definitely you can improve the patient compliance. Under investigation for high dose and narrow window drugs which can be utilized as a GRDDS, Gastro-retentive innovative devices as a mechanism and technology for the developing of the gastro-retentive drug delivery systems. So, and the fourth one, here we can see gastrointestinal permeation enhancement or micro pumps. So, here you can see in the picture. So, this is the picture you can see. So, here you can read here, without permeation enhancement macromolecules do not pass into the systemic circulation. Now, you can see this is the dosage form and the molecule is releasing out, but they have the low permeability issue and they suffers with the some of the bioavailability issue, right. So, your molecule is not passing into the blood circulation, right. So, there is no entry. Yes, these are some of the maybe biological molecules and which are maybe highly water soluble, low permeable molecules, and such molecules will not enter into the, it will not cross into the biological barriers. Such cases we need few modifications in their molecules and we need to come up with a new technology will help for the permeation. Now, you can see here the GIPET, gastrointestinal permeation enhancement. This technology will increases the permeation of the molecules via paracellular as well as transcellular transport mechanism. With this you can see the number of molecule which are able to enter into the blood circulation. So, by improving the permeability, so which will help in the improve the bioavailability of the your formulations. So, here we can use various types of the drugs which are available for the injectable format that can be converted into the oral formulation. With that we can improve the bioavailability of the finished dosage form compared with the conventional formulations. So, these may be the particle size is very less, even you can go into the nanoparticles that will definitely enhance the permeation properties. And this may also, if you come up with the various types of polymers, so that will also control the release in the GIT medium for up to 24 hours. So, ultimately it will improve the bioavailability, reduces the dosing frequency of your formulations. And here these are the few molecules which can translated by using gastrointestinal permeation enhancement and micro pump mechanism. With that we can develop gastro-retentive drug delivery systems which will help in the gastric retention time, and we can expect high bioavailability of such molecules. And the fifth one, Oleotec, the name itself says that it is nothing but lipophilic. Oleo means lipophilic or lipophilic in nature. So, that is a lipophilic gel system for the high dose poorly compressible drugs. So, such drugs can be converted by using this lipophilic gel systems, and this is also known as that we already discussed. It may come under the category of the raft forming type of the gastro-retentive drug delivery systems, because after interaction with the GIT fluid it will form the cohesive gel layer on the GIT fluid, then it will help for the prolonging the release. Drugs which are acid stable and that required the slow diffusion or control release, such drugs can be translated, and the benefits are it will improve the solubility, and these are safe for heat labile and the high load drugs. So, with this technology we can convert the conventional formulations into the novel drug delivery system by using GRDDS as a mechanism. And the sixth one, Soctec system. So, here again we know these systems are designed for the narrow absorption window drugs. Those drugs need to retain in the GIT fluid. So, such formulation can be converted into these systems. And here you can see we can deliver the drugs for the constant rate in the upper intestine and will stays intact with the stomach despite the motility. That is one of the major challenge with the conventional formulations. So, here when you want to improve the bioavailability of such drugs, riboflavin and ciprofloxacin, people have used with this technology and which showed the high bioavailability, and such cases we can use. And how it works, here are the method we need to develop for various types of the molecules. So, it preferably contain the drug and the polymer which will help in the soaking into the final dosage forms, and here we need to prepare this and we need to soak our finished polymer and the drug into the formulations. So, now you can see the drug loaded microparticles, and with that soaking system we can make the gastro-retentive drug delivery systems. So, with this also we can expect the control release formulations. So, these are the few types of the market products. So, so far we discussed on the various technologies, and now we can see some of the examples here also in the various types. So, here by using the floating system, hydrodynamically balanced system. So, that is also one system which will help for the as a product, and then floating capsules, floating tablets and the raft forming systems which will help for the as a gastro-retentive drug delivery systems. So, in the first one, that is a Medopar HBS which contain levodopa and benserazide. So, which will help for the treatment of the Parkinson diseases, and with this floating system we can maintain the drug concentration for longer time in the blood, and these are the chronic diseases. Such cases, yes, novel drug delivery systems are preferable. And the second one is Conviron. So, here we use iron as a drug molecule. So, again these are the floating systems. This will help in the improvement in the iron absorption in the stomach. And the another one is the floating tablets which contains the diazepam, and which will also help in the various sustained anxiolytic effect and which avoid the fluctuation in the plasma. And the another market product, that is Topalcan, which will the drug name is Almagate. So, that will help for the various types of the reflexes which are happening in the gastric fluid. So, these are some other molecules: ciprofloxacin, Almagate, that is also again which comes in the gel forming, and that will also help in the reflex systems, and ciprofloxacin will comes in the category of the effervescent floating tablets, that is low density gastro-retentive drug delivery systems. So, it will help for the antibacterial properties, that is very important, and also these are the based on the technology, that is Accordion pill. This comes in the carbidopa and levodopa, and that will explain. These are already we have discussed in our previous slides, and it will show the prolonged and the stable drug release in the stomach. And the another formulation comes with the analgesic acid and antacid, that is also raft forming, that will help for the treating of the heat burns and acid reflux in a gel format. So, these are the various market products, and there are the so much literature is available on the various types of the gastro-retentive drug delivery systems. And if you go and see the various literature, that is also speaks on the various evaluation strategies for the gastro-retentive drug delivery system. But with the time limit, and we have focused on the what are the gastro-retentive drug delivery systems, and then we have discussed various types of the gastro-retentive drug delivery system. Later we have discussed on the recent advancements, some of the market products on the gastro-retentive drug delivery systems. So, with this we are going to stop our gastro-retentive drug delivery systems, and our upcoming classes we are going to discuss on the micro encapsulation and their technologies, and in upcoming classes we are going to discuss on various types of the novel drug delivery systems. So, with this we are going to stop today's lecture. Thank you so much.